I'm here.
Hi, David. How's it going?
Not bad. I've got a bit of man flu, but besides that, I'm all right. How are
It's
you?
it's
You're all right?
always the season for man flu right now.
It is.
Yeah, good, thank you.
Good. I've just noticed that transcript bit popped up when it's recording everything we're saying, so I'm going
Oh
to
no.
get rid of that. So wondered what it was, and I thought the chat had gone mad. We'll give it a few minutes for more people to join, and then we'll just do a brief kind of start. So is there anyone else from AccuRx who's going to be on the call then, Mahir? Or
No, it will just be me.
Okay, all right. Well, I'll monitor the chat then. Anything I know the answer to, I'll answer, and if not, we'll go through it at the end.
Sounds good.
I'm trying to remember how long we got. Did we put this in for 45 minutes? Or
I think we've got an hour, but
we've got an hour.
it
Okay,
shouldn't
well,
take that
yeah,
long.
yeah,
So
yeah,
there'll
yeah.
be plenty of time for Q&A.
Yeah, we can do the Q&A at the end then.
Yeah.
If that's easier with you, because it'll obviously
Yeah.
we've been interrupted. But if there's any hands go up, are you okay with me just
Yeah.
letting you know? Yeah, is that all right?
Yeah, that would be
Cool.
fine.
Right. Well, I'll monitor the hands and I'll monitor the chat then.
Cool,
So what's
thank you.
going on? We'll give it to, what is it, 31. We'll give it 2 or 3 minutes and then we'll kick it.
Alrighty, sounds good.
Cool.
In the meantime, let me just share my screen so everything.
Yeah. Thanks for that report, by the way. I just got that a minute ago.
Oh, that's all right.
I'll have a look through it in a minute. But...
Cool. Let me know if you have any questions.
Yeah. I think I understand. We start at 33. We'll just give it one more minute.
Right.
Right, I think we'll make a start. So thanks for joining, everybody. For those of you who don't know me, I'm David Coote, System Architect for HBL ICT. If we just go through a bit of housekeeping, I'll keep an eye on the chat. If anyone's got any questions during the Mahir's demonstration, if you can just put your hand up and I'll keep an eye on that and we can try and interrupt Mahir. If not, if you want to leave it to the end of the chat, we should have some time at the end to answer your calls. Just one point, we are recording this session. We do put these on our YouTube channel so people can go and have a look at them. So if you don't want to appear on camera, we suggest you turn your camera off. So Mahir, I'll hand it over to you. So this is Mahir from AccuRx, and he's obviously going to be talking about patient triage. So over to you, Mahir. Thanks.
Thanks very much, David. Hi, everyone. Hope you're all having a great day so far. So my name is Mahir. I'm an implementation specialist here at AccuRx. And today we'll go through some patient triage training. So what we're going to cover today, so I'm going to show you how you can submit and manage a patient triage test request. So this is something that we really recommend practices to give a try at, just because it shows you the patient side of things. And then once you submit that test request, it will also you'll have a request within the inbox that you can play around with and test out the different functionality that we have to offer. After that, we'll go through a little bit of customization, so how to customize your settings and make it more appropriate for your practice. And then we'll end on how you can start sharing your patient triage link out to your patients and start getting those requests coming through. Before I get started, I just wanted to show you all of the different features that you have access to. I'm not going to cover all of them in this demo, but if you have any questions on any other feature aside from patient triage, I'm more than happy to answer any questions around them. So you will have access to these products. So this is our messaging bundle, which includes SMS Plus. That's the ability to send out outbound text messages to your patients with the option to get a reply directly from the patient. You can attach documents and NHS advice links. We also have flurries, which are our medical questionnaires that you can use to monitor long-term conditions, as well as secure cough funding. We also have batch messaging and appointment reminders. Does exactly what it says on the tin. So batch messaging, send a text message to a large group of patients at once, and appointment reminders basically allows you to set up text message reminders to remind patients of their upcoming appointments. And then you also have the remote consultations bundle, which includes patient triage, which we'll cover today, as well as video consultations, which allows you to send a link directly to your patient to start a video consultation. So again, like I said, I'm just going to be covering patient triage today, but if you have any questions on any of the other features, please feel free to type it up in the chat section and we can cover it towards the end. Going to go straight into it, and I'm going to submit a patient triage test request. So I have my clinical system opened here with a test patient. The test patient is not required just yet, but I'm going to show you why I have that up very shortly. My clinical system of choice today is EMIS, but I just wanted to say if you are a System 1 practice, the functionality of patient triage works in exactly the same way. The only difference is when you save to record in EMIS, it will get saved as a new consultation for that patient. And when you save to the record in System 1, it will get saved as a new journal entry. So that's the only difference between the two clinical systems and the functionality in AccuRx. Other than that, patient triage will work in exactly the same way, so it doesn't really matter what clinical system I chose. I just had to choose one. So to submit a test request, all I need to do is navigate to my AccuRx toolbar over here, click on my initials on the right-hand side, and then you should see an option called patient triage. So patient triage is our online consultation solution. The basic premise of it is that you have this unique practice link that you can share on your website, for example, and then patients can use that link to submit admin or medical requests. So this is, again, a great exercise to just try out, to get a feel of how the flow works, and then you can also have a look at what tools we have available for you when it comes to managing the request. So I've just clicked on patient triage and it's taken me to this patient triage landing page. Here, this is sort of the one-stop shop for all things patient triage. So you can submit a test request over here. You can customize your settings over here, which we'll touch upon in a little while. We also released a brand new dashboard section here, which basically allows you to see how many requests you get coming in, how much your patients are using it, and you can actually filter that by day and by hour. And that's really good for sort of capacity and workforce planning. And you can also filter this for medical and admin, or isolate each of those request types. And finally, the last tab here is how you can set up patient triage. And this essentially just gives you access to your unique practice link. So this link will be the way patients can access your form, your patient triage form. And all you need to do is copy that and then share it out onto your website, for example. So we'll start off with submitting a patient triage request. So I'm going to click on what is patient triage, and then there's this big blue button that says create a patient request to see how it works. So I'm going to click on that, and this will take you to your unique practice link or your unique form. You should be able to see your practice's name and details on the top left-hand corner. And this is what the patient sort of lands on as soon as they click on your link. You'll see that patients can submit an admin query, a medical request, or they can see online advice, which basically just takes them to the NHS website where they can navigate their symptoms. You will also see towards the end that there's an option to log in with your NHS login details. If patients opt to do this, then they can skip some of the steps on the form. So that's particularly when the form asks for like the patient demographic information and things like that. So I'm going to do this demo with a medical request, but I'm just going to touch upon admin query just to show you the different options that we have. So I'm going to click on I have an admin query, and you'll see that the first page asks you to confirm that this isn't a red flag or an emergency rather. So it shows you a couple of different red flag symptoms, and if you have any of these, then you'd need to seek urgent medical assistance, and this form is not intended for that. So you'll have to confirm that none of these are present to continue with the form. And then these are the various options under admin request. So if you click on either of these options, there will be questions specific for that request type. So for a fit note, for example, there'll be questions specifically related to fit note and so on. So these are the different options. If there are any questions about that at all, please let me know. Otherwise, I'll move on to submitting the medical request. So I'm just going to go back, and then I'm going to click on I want help for a medical issue. Again, you'll see that I'll have to confirm I don't have any of these red flag symptoms. So I'm going to click none of these are present. And then this is the only page where it asks for details around the nature of my request. So 5 questions. It's a relatively simple form for the patient to fill out, and it's all free text. So the first question is, please describe the medical problem. I'm just going to use the example of a rash. Patients can also attach photos with their request. So patients can attach up to 5 photos. And if they click on attach a photo, they'll have to confirm that the photo doesn't have any sensitive information in there, or and they'll have to agree to that. And once they click continue, they'll be given tips for how to take a good photo. So I'm just going to upload a photo of a rash that I have in my desktop, and then click continue, and you'll see I have 4 images left to upload, so I have the option to add more if I want to. The next question is, how long have these symptoms or concerns been going on for, and have they gotten better or worse? I'm just going to write 1 week, getting worse. Is there anything you're particularly worried about? So this is an optional field, but in this example, the patient might say something like, it is starting to get itchy. How would you like us to help? So this is a really good question to sort of gauge the patient's expectations off the back of this contact. So I'm just going to write, is there a cream for this? And then finally, the last question here is, please enter any times during opening hours where we cannot contact you. And again, this is optional, but I'm just going to write at 3 p.m. I am doing the school run. And then I'm going to click continue. And then the next page is where you can enter your patient information. If you have logged in with the NHS login, you won't have to complete this page. You would be taken straight away to the final page. But you'll see here when filling in this form, I'll be asked to submit this on behalf of myself or for someone else. So this proxy flow is really useful when you're submitting the form on behalf of a child, for example, or someone that's not very tech savvy, you can't use the form. But we'll just submit this request on behalf of myself, and I'm going to enter my test patient's details from my clinical system. So let me just do that. And when you are doing this at your practice, submitting a test request, I would recommend you just use the test patient's details also. So this phone number section, what we do with the number provided, we match it with NHS Spine, and that's how it comes into the inbox as a matched patient. So when the patient submits it, we check their details with NHS Spine. If there is a match, the request will come into the inbox with a matched patient. If not, the patient or the request will be unmatched, and I'll show you exactly what that looks like. I'm going to enter an invalid number right now. The next question is, do you have access to this phone right now? I'm going to say no, but if I did say yes, I will be sent a code to my phone as a text message, which I can then use as 2-factor authentication. I can type it up, and in fact, let me just show you what that looks like. So I'm going to say, yes, I do. And a text message will be sent to this number, which I can then confirm here. I'm just going to say I don't have that phone because that number is not valid. And then I'll be able to continue. So the final page here is where I can review my request and see all the details that I put into the form. And the last questions here are around how we can contact, or how I would like the practice to contact me, should that be required. So I'm just going to click on text message, but then there's also an option for phone call, video call. We do say that this may not always be possible. So if a patient asks for a video call, for example, and it's more appropriate to just send them a text message, that's completely fine. We do say that that's just a guideline. And finally, once I'm happy with everything, I can click submit request, and that request will be submitted. This final page will just tell you the next steps, and this is all customizable in the settings page, so you can actually change the wording here, and to give a little bit more context around what to expect next.
Here, just quick question in the chat.
Yeah.
Is this the same process reception will use when completing on behalf of a patient?
No, great question. So that this is separate. So I'll quickly touch upon reception, our reception flow whilst before I move on to how to manage a request. So so that I've now submitted it from the patient side of things. We'll quickly switch over and touch upon how a receptionist can do it exactly the same thing. So if a patient calls in and you'd like to submit a request on their behalf, you would have them opened up in your clinical system. So you'd ask for their details and then you'd get them opened up. And then you'd open up your inbox, which is located on your toolbar on the right-hand side here. The inbox is fully integrated with your clinical system. So on the bottom left-hand corner of the inbox, you should see the patient that's currently opened up in your clinical system. It's just taking a little while to load. So yes, so it's showing the patient that's currently opened in my clinical system, and you'll see that on the bottom here, it says create a patient triage request. So all the receptionist needs to do is have them open in their clinical system, and then within the inbox, click on this, and that will take them to a page where they can enter details regarding their admin query or medical request. The benefit of doing this, as opposed to using the link that the patient would use, is that you won't have to actually fill in the patient details. That will already be pulled from the clinical system. So now I can just over the phone ask the patient these questions, so check that they've not got these symptoms, and then type these up on behalf of the patient, and then I can click continue, and then that will submit that request. So it's just a more condensed version of the patient flow.
Hey, a quick question from me on this. So is there, as far as reporting goes, is this reported separately, or is it just all included in the total figures for online consult coming through?
Great question. I believe that's something that we know, but I don't know if that's practice facing yet, that data. What I can do is I can double check that and get back to you on that. But I'm sure if you reach out to support, they'll be able to give you a breakdown of the numbers of how many requests come in through reception flow rather than the actual patient flow. But I can double check that and get back to you.
Yeah, because I think if sites are kind of doing the total triage model, then that would be very useful to see how many people are still coming through the phone systems and using this.
Yeah, that's completely fair. Yeah, I'll double check that. Thanks.
Cool, thanks.
So moving on to the practices side of things now, when a request is submitted. So again, you can view all requests by clicking on the inbox icon. So all patient triage requests goes into this centralized inbox, which I've already got opened here. And more specifically, all requests go into the to assign folder. So I'm just going to click on that. You can filter requests for admin queries or medical requests. So that's really good if you want to isolate those request types and just view only that kind of request. Otherwise, you'll see a full list of all the requests that have come through and are currently opened, and you can work through them that way. So right at the top here, that's the request that I just submitted at 11:45. So I'm going to click on that, and you'll see that it says patient not found. That's for two reasons. So firstly, I use the test patient's details. They're not real. You'll never find them on NHS Spine. But also I entered an invalid number. So if a patient enters an invalid number from their end, it will likely come in as this. However, we don't find that happens too frequently. So you won't have to do it, but it's really easy to match this request to an actual patient in your clinical system. So I can click search for a patient, and that will pull the date of birth that the patient has inputted into the form into this search field here. And then, as you can see, I've just found them here. However, if they've also entered an incorrect date of birth, for example, I can type in their name or their NHS number to search for the patient, and then I can match them that way. So I'm just going to...
quick question in the chat. I think
Yeah.
I know the answer, but I'll let you answer this. Will all AccuRx users see the triage queries coming in, or can we choose who can see them?
Great question. So this centralized inbox is can be viewed by anyone at your practice, so any staff at your practice. If you want to have notifications enabled, so you just have to come into this to assign folder here, and then you can toggle this notification on or off, and that will determine whether or not you see these numbers on your toolbar, within this red dot, to notify that you have some unread requests.
Thanks.
No problem. So I'm just going to confirm this match. And typically, this is how a request will come through to your inbox. This will already be matched to a patient, so you won't need to match it. If you have matched it to an incorrect patient, you can quickly unmatch it and then go through that process again. So you'll be able to see within the request the nature of their request, their contact preferences and patient details, as well as any attachments that the patient has uploaded with their request. And you can also click preview to view the attachment in your browser. And in terms of managing the request, you have a couple of different options now. So you can save to record with the click of a button, including the attachment. But you also have the option here to remove the attachment when saving to the record. I'm going to click save to the record, and I'll show you exactly what that looks like in EMIS. So in EMIS, it will get saved as a new consultation. In System 1, it will get saved as a new journal entry. All patient triage requests get saved with the SNOMED code eConsult via online application. So I'll just refresh my patient's clinical details, and then you'll be able to see that request just being saved now. So I have a couple of different options now when it comes to managing this request. So I can reply to the patient directly using either free text or a template or a Flurry questionnaire, for example. If I want the patient to respond back to me, I have the option to do that, and that will include a link within the text message that the patient can then use to submit further information or further pictures. So really useful if they've not provided clear pictures, for example. I can see that there's a question within the chat. It looks like you can assign the whole folder to staff members. Are we able to turn on notifications just for admin queries rather than all? Great question. You can only assign notifications for the bigger like the highest level folder, so you can only do it for the to assign folder. I will show you how you can configure notifications. So AccuRx admins can configure notifications for all staff at their practice. So I can quickly touch upon how you can do that for each staff member at your practice. There's a really easy way to do that. So you can, when submitting or responding via text message, you can also attach documents via from your desktop or your clinical system, and you can also send or attach NHS.UK advice. So this is a really great option as well. And then I'm going to click send and save, and that will send directly to the patient, and will get saved to the patient's record. You can also add a note to a request. So notes are a great way to communicate internally about the status of the request. So for example, I can let other people at my practice know that I'm working on this by typing my initials and then typing is working on this, and then adding that note. We'll put it into a yellow box. Notes are only visible to staff at the practice, so it doesn't get saved to the clinical records, for example, and the patient doesn't get to see it. So this is a really great way of sort of providing status updates for requests. And finally, you can assign requests to either an individual or to a team. So if you just click on this field here, you'll be able to see the individuals at your practice towards the top and teams towards the bottom. If you already know who you want to send it to, for example, the doctor's team, you can just type them up here and then click on the relevant team. And then you can also assign a note along with it. You can click assign, and what what happens when you click assign is that it removes it from the current folder, which is to assign in this case, and it will place it into the either the individuals folder or the team folder that you assign it to. So I'm going to click assign, and then that should remove it from this folder, and we'll be able to locate that in the doctors folder. So the doctors folder can be located under teams, and if you assign it to a colleague at your practice, you'll be able to see it in the colleague section here. So I'm just going to locate that request now. This is the request. Once there are no further actions, you can mark the request as done. This will keep your inbox tidy, and will prevent what has happened at our test practice, where I've got 972 requests in the inbox. So it will prevent like a build up of and will keep your inbox tidy. We don't delete requests though, so if you mark it as done, you can quickly retrieve that request either by having the patient up in your clinical system and then clicking on the patient's name in your inbox. This will show all of the historic interactions that you have with that patient. Or you can go to this all folder, and you'll be able to see a list of all the requests that have been marked as done.
Hey, another quick question. Can the patient reply to this text message?
Yes.
Forum, yeah.
Yeah.
Where would that go if you'd already if you already found it, say, a team of doctors, for example, would everyone get a update saying that there's been another text?
Yeah, so if the folder, or if the request is in the doctor's folder and then the patient replies, then the doctors at the practice will receive a notification. So right. There'll be a red notification within the folder. To request a response from the patient, all you need to do is just check this option here. And then as soon as the patient replies, their response will be within this conversation thread here, kind of like an SMS thread, if you will, and that will be easily visible by staff at the practice.
So what would happen if you didn't tick that box and they tried to reply? Could they? Or would it just send a message saying you can't reply to this?
Yeah, so the patients won't be able to reply to the text message that gets sent to them. They will have to reply using the link. So they'll just get a failure notification if they try to reply. I think that might be all with regards to managing a request. Oh, also, if you wanted to mark a request as urgent, you could do that using this button here. This will highlight the request with a flag, and then it will take it to the top of the list if it's not already there. Some practices use this right at the beginning of the day when they initially sort of scan through all of the requests, and they flag the more urgent ones so that they can work on that at the beginning. But then you can also easily mark it as not urgent. I also had one more thing that I wanted to show you. So when sending a reply to the patient, it's not showing right now, which is not very helpful. But you should see over here where my cursor is sort of hovering over, there will be an option to send a booking link directly to the patient. So the way this works is that you can select whether you want to send a telephone or a face-to-face booking link directly to the patient. So there's an option of responding to the patient that way. Our self-book option is fully integrated with your appointment book. So you'll be asked what slot within your appointment book you'd like to send the booking link for. And then once you send it to the patient will see a live reflection of all the appointments available within that specific slot type that you send to the patient. And then if the patient books in, they'll be automatically added into your appointment book. So that's a really useful feature that we recently implemented, which will allow you to send and manage bookings virtually, essentially. So you don't need to sort of call the patient. They can use the link to see all of the available times within your appointment book and then book that in. The link is a single-use booking link, so they can't use it again and again. So once they use it the first time, they won't be able to use it again. And it also expires within 48 hours. So if they haven't booked by then, you will need to reissue a new link to the patient. I'm sorry it's not showing here. I'm not entirely sure why it isn't. But I can send a quick demo in a follow-up email just to show how that functionality works.
Another
I can
question in the chat here, yeah, just popped in.
Yeah, so is this the self-book feature? Yeah, that's correct. So we integrated the self-book feature within the inbox now. So you'll be able to send a self-book link directly to the patient. It should be here. I'm not entirely sure why it's not in our test organization, but you should be able to see that in your at your practice. And that covers, I think, everything when it comes to managing a request. If there aren't any more questions for with that, or if there are, please feel free to type it up in the chat. Otherwise, I'll quickly touch upon how you can configure notifications, because I did promise that I'll show you how to do that. But yeah, feel free to type up any questions in the chat section. So to manage notifications for your team, the AccuRx admin at your practice will just need to go click on their initials in the AccuRx toolbar, and then click on Manage Organization. And then if you scroll down to your organization, so this heading, you should see an option to manage team notifications. This will take you to sort of a matrix where it shows you all of the users at your practice, so all of the staff at your practice, and you'll be able to configure notifications or switch them on based on what you'd like them to see. So the most important folder here is the to assign folder, which will be towards the end. So whoever you want to be notified of new requests in the to assign folder, you could just switch them on. For example, let's switch on Nurse Amy Khan for the to assign folder. And if you want someone to not receive requests or notifications rather of new inbound requests, you can just uncheck them here. But staff at your practice can also do this on an individual basis by, again, clicking on the inbox, clicking on the to assign folder, and then using the notification toggle to sort of set themselves up for notifications. All right, if there aren't any other questions on that, I'll move on to how you can customize the settings in your for your patient triage form and make it a little bit more suitable for your practice if it's not already perfect. So again, coming back to the AccuRx or patient triage landing page, I've come here by clicking on my initials and then patient triage. It will take me to this page here, and then I can click on settings. Here, I'll be able to customize specific aspects of my form. So I can edit the welcome page message and the submission confirmation message. And then you can see exactly where it is on the form that you are modifying text for. To edit the text, all you need to do is click edit, and then it will allow you to edit the certain parts of the text. So you can add as much or as little information within here that suits you.
Here's just a question in the chat. Can we
Mhm.
start with setting this up for admins only?
Great question. So there is a way of launching with admin only. It's quite a manual process, but we do have some guidance on it on our YouTube channel. I can forward a video on that, but I'll just quickly touch upon how you can do that as I continue going down the settings page. So that's editing your welcome and submission confirmation message. Patients, if they enter their phone number within the patient flow and they confirm that they have their phone on hand, they can opt in for a SMS confirmation message, and you can actually edit the messaging that gets included within there. And you also see that there's an option to suspend patient triage. So this is just to switch off your form for whatever reason, ad hoc. So if you have a staff member off sick, for example, or if you have a backlog of requests that you want to work through before accepting any more, you can suspend your form entirely for a maximum of 4 days. To do this, just click edit and then toggle the suspension on, and that will switch off your form for both medical and admin requests. You will see over here that there's an option to suspend medical request access only. If you click on that, that will still make so patients will still be able to submit admin requests. Now, this is how you can start with admin only. So if you suspend the form and then you also suspend medical request access, and then you can set your resume date for 4 days from now. This is how you ensure that patients can only submit admin requests through your form. So if you're happy to receive admin requests, just use this option. And then once you save changes, that will take effect and patients will only be able to submit admin requests through your patient triage form. If you want to launch with patient admin only and you want to extend it beyond 4 days, you'll just have to come back into the settings section and retoggle the suspension for an additional 4 days, for example. Let me know if there are any questions on that at all. Moving on, we have an out of hours setting. So you can actually schedule your practice's opening and closing time. And if you want to switch off your form outside of your practice's opening time, you can do that using this toggle here. And similarly, you can also suspend medical request access only. So if you're happy to receive admin requests out of hours, you can check this option here and that will only suspend medical requests. And finally, we also have a redirect to an existing repeat prescription service. So if you already have an existing repeat prescription service and you don't want patients to use patient triage as to order any repeat prescriptions, you can just toggle this on and then enter the service link here. So in this case, we've got the NHS app, and then type in the service name. And then when patients request repeat prescriptions through the AccuRx form, they'll be signposted to this existing service. So they'll be told that we already have an existing service. Please use the NHS app instead, for example. So that's how you can edit the settings on your patient triage form. If there are any questions on that at all, please let me know.
Hey, one of the questions I get asked when I'm out and about is, are there any plans for patient caps? So we can say that we can only have 20 online consultations, say on Monday mornings or whatever.
Great question. So that is something that we had considered in the past. I'm not entirely sure where that is, where the process of that investigation is. So I can get an update on that and get back to you. But in any case, if you just provide me, are you aware of what practices actually asked for that? Because then I can pass that on to the team, and if they want to do a little bit more research into what use cases.
I could probably dig into the recess of my memory and remember, but I get asked that question quite a lot because that's one of the worries that practices have when they turn this on.
Yeah, no, that's completely understandable. I'll pass that feedback on to the team and also see if there's an update with the research stage of that.
Thanks, mate.
No problem. So that's customizing your settings. Now I'm going to move on to how you can set up patient triage at your practice. So again, navigating to this landing page by clicking on your initials and then clicking on patient triage, you can click on this final tab here to copy your unique practice link, and then you can add that onto your website. We've sent everyone here a patient triage training pack via email. So if you search your inbox, you should be able to locate that. And within there, we provide some banners that you can use on your website. If you can't locate that, I can send that within a follow-up email. So no worries about having to dig through your inbox for that. I can send banners that you can use. But yeah, it's just as simple as promoting your link on your website. You can also amend your phone scripts to let patients know that there's an online service that they can use, for example, or you can customize your automated message. We have also integrated with the NHS app, which means that patients can submit requests through the NHS app. The settings that you have on the settings that you configure over here will also translate to the NHS app. So if you suspend your form, for example, it will also be suspended on the NHS app. So that is also another way. We don't find that there are too many requests coming through the NHS app at the moment, but that's also an option for patients. But yeah, that's all in terms of sharing patient triage. Essentially, the amount you promote it, that sort of correlates to the amount of requests you receive. But as a starting point, most, if not all, practices that go live with patient triage add it onto their website. So you could definitely start with that and then see how it goes, to see what kind of level of requests you get coming through before sharing it out in other ways. Practices also send a batch message out to either groups of their patients. So that is an option for you if you want to sort of stagger the sharing of your patient triage link. So you can start off with 20 to 40-year-olds to begin with, and see how that goes and before going to the next cohort. So yeah, that's how you can share patient triage. Are there any questions on anything I demoed for you today?
I don't think there's anything else more in the chat. Whilst we got you on the call, Mahi, I was just thinking, if there's no more questions on patient triage, has anyone got any questions on batch SMS or Flores or any of the tools that we've got in the last few weeks?
I can see there's a question in the chat. Do the settings allow you to limit age? So no, there isn't an age limit for the form. I mean, if someone's filling in the form on behalf of a child, for example, they could use the proxy flow. It's not typical that a patient of 7 years of age submits a form on behalf of themselves, so that we do have the proxy flow for when an adult is filling in the form on behalf of a child.
Okay, great. I don't think there's any more questions. So just to finish off, we will share this link. So obviously we've recorded this session, so we can share it if you want to share it with any of your colleagues. If you let David or Tracy know we're on the call, or even myself, and I can just send you the link. Someone's just entering quite late. But yeah, so I think really that's about it. Just to say thank you from here for coming along, and thanks for everyone for attending.
Yeah, thanks for having me, guys.
Yeah, thanks very much. Thanks, everyone.
Thank you. Take
Cheers.
care.
See you later.
Bye-bye.
Bye.
Bye.